Hello everyone, we are here with our dear patient with post-op 6 days. 6 days ago we did surgery together. He wants natural change but give a good definition to nose. So our main complaint was about the tip of the nose. Or the skin, there is some thickness under the skin. We try to make it a little bit more stronger, so it will give more definition. Our goal is mostly not to make a small tiny tip, especially with patients who wants a little bit natural change, and especially the male patients. It's not good to make too tiny pointed tips. It's not looking really nice and not functional in the long term. To give definition for the nose, you need to stretch the skin. Basically, what we are doing with augmentation is stretching the skin. The thinning of the nasal fat, nasal tissues under the skin is the secondary part of the surgery. First, as you see, there are some irregularities here. We make some rasping this part, and then we make a total augmentation for the bridge part. So the nose is starting in a higher position. Of course, it's very early, there are serious swelling, but as you see, the nose is starting in a higher position, and also tip goes down a little bit. You can understand this in oblique view better. It comes down a little bit. So we lift it up and make it more strong. Again, due to swelling, it's slightly uplifted than the final outcome, which we will see after 6 months, 1 year. In these kind of thick skin patients, even 2 years later, you can see the skin is shrinking. And this part is our major goal. See, it's strong. We give a robust tip. But of course, there must be balance. If you make it too long, also it's looking unnatural. We do slight nostril reductions, but we have more strong tip now. For the guys especially, if you do too much nostril reduction, also it's looking unnatural. And we try to, in most of the cases, I like to keep this roundness on the nostril, which is the common sign of natural rhinoplasty. So we make incision just in this crease. I like to keep this crease naturally like this. So it's almost undetectable after healing time.